Bismillahirrahmanirrahim. Thank you, CEO DRAB, Dr. Ubaidullah Malik, for accepting our request to chair the session today, and the co-chairman, PPMA chairman, Dr. Tahir Azam, Central Executive Committee members, Dr. Kaisar Waheed, Mr. Haroon Qasim, ladies and gentlemen, thank you very much for coming to today's session. My topic is redefining pharma marketing, and why not? If we don't do this, then who will do it? So from data insights to impacting patients' life, that's the theme and the title of today's conference. So the old playbook versus the new vision. So when I joined pharma industry back in 91, so going to the doctor's clinic, the only objective is to have 12, 13, 14, 20 calls in a day, and every day manager asks how many calls you made. And the other thing that we do, pen, clocks, tissue boxes. And if I look back retrospectively, I believe what a waste of money from pharmaceutical industry. Now, look at the power of the AI. Now you can download an app on the doctor's mobile phone, and when he clicks a button, his personalized video to his patient by name can directly go in the real time after visiting the clinic, and the doctor, Salman, explain the diabetes, the insulin usage, the contraindication, the side effects, and the prevention they should do. So that's the magic of today's world, and that's the new vision. We all should look into it. To shift from transactional to relational, that how you can solve the problem of the patient and the doctors both. So it's not that you make a call, give them a wall clock and get the prescription, then see the ROI of your call. Storytelling through patient centricity. My brother Farhan Malik will talk further on it, but let me tell you, on 9th October, we met 3 interventional cardiologists for the data points after a very long study that he presented in ESC. And after a while, he said, Jamshed, do you know, this morning, one of the representatives came to my clinic, and he's a diplomat American board. Normally, he doesn't meet pharmaceutical representative. So he said, he came to me and he said, sir, I want to know your anniversary date. So he said, why? He said, I need to send you the cake. So he said to me, out of joke, I told him that I have 3 wives. You know what? What the representative told him. He said, sir, tell me the 3 dates, and I'll send you the 3 cakes, and that will ensure my promotion actually. And honestly, मैंने नाम नहीं पूछा कंपनी का, क्योंकि मुझे डर था कि हमारा कोई चीज़ा ना निकला उसके अंदर. So storytelling is something that we need to tell the doctor about how you can change the life of the patients. And one story that I would like to share, our Discovering Diabetes project. We partnered with Wasim Badami, an influencer. Mar and Asen probably will talk more on it in the later part of the conference. So he did not get the idea, what you want to do with me? I said, you are a public figure. If you tell something, people will follow you. So we found out the real stories of the patients who did not care about their diabetes and had amputation, had heart attack. And then we dramatized the whole video. Uploaded on the social media, guess what? 4 million plus views. 1 million diabetics, to be diabetics, contacted our chatbot and the toll-free number. 650,000 to be patient actually went to the labs, ESA lab and the Chughtai lab, to have the test of the fasting sugar free of cost. And 400 plus diagnosed diabetics, not aware. And most of them were thankful to us that due to your video of Wasim Badam, now he's a celebrity among the diabetic patient. And anywhere he goes and people, love him. So digital transformation and data-driven insight. I was reading on the net, one of the social media engagement company, Live World, they ran a survey on internet with the 7 emotional drivers for the patients, because they want to find out who are the top 50 companies, not in the doctor's mind, in the patient's mind. And that is startup, Live World, based in Silicon Valley. The first driver was efficacy and the safety of the product. The second is about the trust on the company, on the product. Third is the emotional well-being. So 3 drivers. First brand to be announced from that company was Keytruda, pembrolizumab. The second brand was, the name was a little difficult. It is called Trikafta for the cystic fibrosis. Third one was semaglutide, Ozempic. And they wrote the comment on this finding, the only thing that thousands of patients voted for these 3 products because they believe that product provided them the solution and the mental peace. And when you look around, this morning, one of my cousin from UK called me that, oh, you are coming, please bring what? Trebizetide, 4 injection. I said, I'm coming from CPHI, it's a long trip, and it's a temperature control. Nobody prescribed her that drug, that injection. And top of it, UK has a different legal obligation. So pharmacists can advise you this GLP-1, not the doctors. Pharmacists been allowed to write GLP-1 in UK. But they don't bother because so much of the noise around with the different stories, they are now convinced to have this. So leveraging data, humanize, not homogenize. So the status quo thing, every doctor need few things. तो अगर मैं भी ले जाता हूँ बैंकॉक और आप भी ले जाते हैं, what is the difference? And one of the author mentioned that is the pharmaceutical marketeers' responsibility to decide what to do, what not to do. It's not the doctor. We shouldn't blame the doctors. Because as a customer, they can ask anything from you. You who going to decide what to do, what not to do. So ethical marketing and trust over transactions. So ethics, when I hire anyone in marketing, the first question is, what is ethics? How do you define ethics? 99% don't know. What is ethics? Ethics is about difference between right and wrong. And if you are ethical, you stand with the right thing, no matter it gives you the damage or the loss. So when I ask, give me an example of your personal life, not professional life, about your ethical behavior in the last 5, 6, 10 years. Very few of them can give their personal life example. So how can you build the trust of the doctors when you are not yourself ethical? When you are lying, miscommitting, and I'm talking about everyone, including myself. And I'm extremely thankful for PPMA for hosting this conference and Health Asia to organize. Why cannot we talk with each other? Why cannot we discuss these hard things, difficult things, sensitive things? Why cannot we find out some solutions together? Everyone does it, the whole world sitting together. You go to US, you go to UK. You find out every year multiple conferences where different pharma companies sit together and talk about it. So trust is the new currency. And the power of partnerships. So partner with tech companies, NGOs, and your even rivals. And Harvard endorsed it with the terminology co-opetition, meaning cooperation with the competition. So when I joined GD Searle in US, Chicago, and as a management trainee, they gave me the brief introduction of the company, and I found out that the flagell is of the Searle research on that day only, it's 94. And we heard in Pakistan always it's Hex and Aventis. So I asked the president of the pharma business, it is not your product, because I always relate this product to Hex or Aventis. He said, no, this is our research. And we have the complete range of this flagell ER and flagell, I don't know how many SKUs they have. So I said, why did you give it to Hex or Aventis? And you know, they've been transferred into Ron Pauling Rohrer, there's 3-4 companies been merging together. And so he told me we were not strong in that segment. And this company was strong. And we cannot cover the whole world, even not in US, 52 states. So what is wrong? It's a business deal, it's a business interaction. But somehow in Pakistan, we don't join hands. Everyone is putting a plant of $10 million to produce biosimilars. And why? Why not? It can combine together. We can save money, we can put it into our fractured healthcare system. So call to action, the last slide, be a catalyst. And what to do. As we talk about the redefining of pharma marketing today, first listen to the patients. We are only focused on the doctors. Yes, that's our customer that's prescribing our drug. But also find out what patients are saying about their disease, what kind of fear they had, how we can solve their problems. Ethics and transparency, gold standard. I tell always my team, if you do things ethically, with excellence, turn program से कुछ नहीं होता. Excellence का मतलब है कि whatever the resources you have, put your sweat and blood into it. Then only you can make something worthwhile. And then collaboration, break silos. And this is the tipping point today. And I'm very thankful, Dr. Bath, for joining this session. And I think you can actually guide and support everyone to talk to each other. Being a regulator, you can help them to join hands and do something which can change the landscape of the pharma industry and the healthcare system of Pakistan. Thank you very much for your patience for listening.